Hi, my name is Paddington, and I've been feeling a little down lately. I'm not really sure what's up. I usually get this way around this time of the year, and I don't know, maybe it's just the stressors of the holiday and whatnot. I'm thinking maybe I should book an appointment with my doctor and figure out what's going on.
Before going to see your doctor, it's a good idea to prepare for your visit. There's a couple ways that you can prepare. One, you can think about a couple questions that you have ahead of time. That way, when you go see your doctor, you don't forget anything important that you wanted to ask. Another way to prepare is to bring a family member or friend that you trust. That way, you can feel more comfortable during your visit. And lastly, bring any medications that you take so that you and your doctor are on the same page as to what medications you're taking and the dose.
Hi, I'm Dr. Talia. Nice to meet you.
Hi, I'm Paddington.
Paddington. What brings you in?
I don't know, doctor. I've just been feeling kind of sad lately and stressed. I usually get like this around this time of year.
Okay. And tell me a little bit more about that.
Well, things that used to bring me pleasure, like playing bingo, just doesn't really do it for me anymore. And I've been sleeping a lot. I've been sleeping an awful lot.
Okay, so it seems like the sleep is off and your social circle doesn't seem to be bringing you joy anymore. Tell me a little bit about the social support that you currently have.
Well, I live with my wife of 42 years and our little dog, Fifi. And I have good friends, I do. I do have good friends.
Social support can be a great way in managing stress. Confiding in friends and family can be a great way to find inner peace, as well as meditation or prayer or fellowship with church members. And in some cases, you may just need to contact your spiritual leader, someone who you trust and can help guide you through difficult situations.
Well, it's great that you have, it seems like, a social support that you've met with in the past. Tell me a little bit about your daily activity. What does that look like for you?
My day is usually from the bed to the couch to the dinner table back to the couch.
Okay, I see. Gotcha. Is there any particular reason that you don't find yourself being active on a day-to-day basis?
It's just not really any exercise activity I particularly enjoy.
Okay, got it.
So maintaining some activity throughout the day is actually not that difficult. So you can actually do a few easy exercises with the chair. So I'll show you 3 simple exercises that you can do. So the first one, you can start off by sitting down. And this is like, I guess you could call it a chair squat kind of. So all you gotta do is start at the seated position, stand up, go back down, stand up, go back down. Maybe do that for a set of like 5 or whatever you kind of feel, however many you begin to feel tired, and do a couple sets of those. Another exercise that you can do is, these are called kind of standing calf raises. So all you gotta do is you gotta hold the chair for stability, for support, raise your legs, you can go this way, as you can see, raise your legs up and down. And the next one's also really simple in this position. Just keep raising your legs up and down like you're marching, a marching band. Do that for a bit, get your heart rate up, make sure you got some activity going. And especially as you age and grow older, a big thing that is important for your health is maintaining that lower body strength so that you don't trip, fall, or sustain injuries. So I think those 3 exercises can be pretty easy for you to maintain. And it can be kind of not fun to exercise or to go outside and exercise. So you can even do these while you're like watching TV, for example, or you're just doing some other activity, or just waiting, for example. So there's ways to make it fun, and it's a pretty simple exercise, and I think it'll go a long way.
You know, I've tried to talk to people in my life about just my level of despair that I'm experiencing, and I haven't had much luck. No one really knows, or no one has really said anything that's kind of tipped the scales in the other way and brightened my day.
So it sounds like you kind of reached out to everyone in your life. It doesn't seem like they're able really to help you, and nothing seems to work. Does that sound right?
Exactly, but you know, I'm trying. I would like to feel better.
Right, of course. Have you ever given any thought to seeking help from a mental health professional?
No, you know, I don't feel like I need to.
Okay. Well, it's definitely an option, and we can discuss if this is the right option for you. Would you like any more information about what kind of services they provide?
Yeah, do you honestly think that that'd be beneficial for me?
Talking with a mental health professional can be a great resource for many patients who are feeling stressed or worried about the future or their day-to-day life. Many patients are concerned with taking this step because they worry about what this could lead to, whether that be a medication or another doctor or care provider that they would need to visit with. But many times these mental health professionals are highly trained and specializing in issues with stress and can provide a lot of strategies that don't involve medications at all to change your lifestyle and help you deal with these stressful times. Many mental health professionals offer telehealth visits, which can be a lot easier for patients who don't have to commute to an office or take care of parking, things like that. Ultimately, mental health professionals are a great resource to use, especially if you've reached out to people in your life and you are still feeling stressed out. They are highly trained professionals that can help you deal with a stressful time in your life.
You know what? I think I will give some thought into seeing a mental health specialist.
Great. I'm glad that you've considered the option, and we'll get you those resources. I finally kind of want to ask you about something that's often undermined, and that's your sleep. So it's important, of course, that we pay attention to how much rest we're getting in a day, because that's part of our health as well. So tell me a little bit about your sleep patterns.
It's not the best. I really go to bed whenever I feel like it. I don't really have a structured bedtime. I don't really have a structured time to get up since I'm retired. So I just kind of sleep when I feel like sleeping, and it's pretty irregular.
I'd like to talk to you about improving your sleep quality. Smartphones and screens in general are known to cause lesser quality sleep because the blue light that the screen emits actually mimics natural daylight, when that will throw off your circadian rhythm, which keeps you up during the day and awake at night. So using your phone too late at night will keep you up instead of putting you to sleep. It's recommended that you avoid all screens at least 1 hour before going to bed. That includes smartphones, TVs, and computers. All of those should be put away at least 1 hour before you go to bed to get a good night's sleep and make sure you're energized in the morning.
We hope you learned something and that you enjoyed our video.